Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years of experience, here to talk to you today about diabetes. The topic is type 2 diabetes. I just found out I have it. Now what do I do? In reviewing this topic, we wanted to go over the basics of what a person's going to do when they find out they have diabetes. For most patients, you'll find out you have diabetes because of a routine blood test. You're going in for a physical or some kind of exam, and most likely the test will be either a glucose level, if it was a fasting exam, or perhaps a hemoglobin A1C, which provides a 3-month average of your sugar, and you'll meet the criteria for diabetes with an A1C level above 6.5%. A fasting sugar of 126 or higher would also meet the criteria for diabetes, usually then confirmed with an A1C test. So again, most patients are not going to be symptomatic and having medical problems and showing up in an emergency room or an emergency type visit and finding out they have diabetes. Although we do see that frequently, for most patients, that's not how they're going to turn up and find out they have diabetes. Also, many people will know that they have pre-diabetes and the numbers have been rising over time, and at some point in time they'll enter into the door and be told, you have diabetes now, type 2 diabetes. So when you think about where you want to be with diabetes, you want to be controlled, you want to be healthy, you want to be well, you want to have good long-term outcomes and success and health and well-being. And it really boils down to starting with education. So you want to learn about all of these things. So what do you want to be educated in? Well, diabetes education really involves learning about what caused diabetes. How did I get here? What's a genetic component? Is there a weight component? A sedentary lifestyle? All those types of things. You want to have goals. What's my goal for management? How low do I want my sugar to be? What A1C goal would I set for myself? And learn about the complications of diabetes, the things that could happen over time if the numbers aren't controlled, and start to develop a strategy of how you'll make sure that all those issues are dealt with. Who you're seeing to take care of them, what other specialists may be part of your routine, what other doctors you may see, and things of that nature. Now, when you find out you have diabetes, one of the first questions that we often get is, do I need to check my sugar? And the way we do that now is most people use a finger stick machine by getting a small drop of blood off their fingertip and putting it on a test strip in a machine, but that within several seconds will give them their sugar result at that moment. Very popular today are other devices that are usually put on the upper arm that have a small sensor type of filament that goes into the skin and is able to read a sugar from the fluid under the skin, and the analysis converts it into what a blood sugar is probably at that moment based on that analysis. So it's it's not a blood sugar measurement, it's a sugar measurement converted to what a blood sugar probably is based on that number. That's very popular because you don't have to stick the finger, but those devices do have to be attached to the person, to the patient, continuously. They're continuously monitoring the glucose and sending results to a phone or a reader type device that has the results. So patients may want to start checking the sugar, but you don't have to do that initially. If you were just diagnosed with diabetes and your numbers are not too elevated, perhaps your A1C is in the 8 or 7 range, and you're just getting used to everything, and you're learning what you're going to do next, you may not need to know your sugar at that moment. But we always believe that knowledge and education is probably the most powerful tool, and maybe preparing to start to check the sugar would be a very reasonable thing to do at the beginning. The real education is often going to start with diabetes education as a whole, which we mentioned. Then secondarily would be nutrition, a nutrition plan. People will call it medical nutrition therapy for diabetes, often with a one-on-one meeting with a registered dietitian, someone who can work with you to really smooth things out. You don't want to gain weight, you want to have consistent meals, you want to have consistent and maybe limit heavier fatty foods or starchy carbohydrate foods from the diet that you may have had previously, moving towards leaner proteins and leaner carbohydrate foods, as well as perhaps vegetables, more natural foods perhaps, but really learning the basics, learning about portion sizes, even something as simple as learning how to read labels in the store and knowing what is a serving size, what is a portion size, how much do I need to eat. That's really helpful for the patient to start to learn. And if you can combine that sometimes with checking sugar and learning what foods raise my sugar, what foods don't, you can kind of put that together as well. When we talk about education as well, education about physical activity or exercise is very important. The goals that are set for diabetic patients are 150 minutes a week of aerobic exercise. Now, for many who don't exercise as well, that seems like climbing Mount Everest, and that's not going to happen. And I think that we really have to take that easy and kind of tell patients, well, this is what you do now. If you do no physical activity now, then whatever you do next is more than that. And you kind of build from there. Can you start to walk? Can you ride a bike? Can you climb steps in the building that you live in or the house that you live in? Can you start to do more? Can you lift things and do things? And really trying to increase your activity, because what you're really trying to do is make the insulin that's meant to store the sugar work more efficiently. And the more you do, the more efficient the storage of sugar will be to get the sugar out of the bloodstream. As you become more adept at activity, at resistance training, strength building, muscle building, aerobic activity, then perhaps more plans can be tailored to you to work with a specific person or a specific location or a local gym or something that will tailor your needs as you develop those habits. So education regarding comprehensive diabetes education, nutrition therapy, and more physical activity would be the way to start. Now, if we talk about education for glycemic control or the control of your sugar, now you're talking about education about checking your sugar. What are the goals? What sugar do you want to have? Maybe when you wake up, maybe several hours after eating, maybe at bedtime, and starting to learn where your goals are going to be and what would occur if you took a medicine, what would happen to these numbers. You also want to be educated to what are the complications. We kind of mentioned this before. You have to sort of get on board with, need to see an eye doctor. That has to be part of my routine. I need to keep an eye on my feet, sometimes seeing a foot specialist, sometimes inspecting on your own, and then being concerned about kidney tests that will often be done during your medical visits to make sure that you're not showing the beginning signs of diabetic kidney damage, as well as considering, do you have to do checks for the major vascular systems, things that will help prevent or avoid strokes or heart attacks. And that screening may become part of your routine. As well, to prevent those issues, aggressive control of blood pressure, aggressive control of cholesterol becomes part of the diabetes routine. You'd be astounded to hear that less than 10% of the diabetics in the United States have control of all three of those simultaneously: sugar, blood pressure, and cholesterol. So if you're educated on what you need to do, what the goals are, why the goals are set the way they're set, then you're more likely to be compliant with the program. When we now go back to the more comprehensive diabetes education, we kind of talked about a comprehensive education program. Unfortunately, it's limited for many patients. A large academic hospital center, perhaps in a major city, may have a diabetes education center that provides education, maybe through group classes or individual sessions. But very often it's hard for patients to get there. It may not be covered by the insurance and things like that. So sometimes there are other ways of getting that education. But ultimately, as the patient, you want to really seek out that education, again, to be very knowledgeable about the disease. Remember, diabetes is a lifelong disease, and you've just been diagnosed with it, and you want to learn as much as possible. So one of the questions that also comes up with the question of, I just found out I have diabetes, now what do? Is, do I need to go on a medicine? And at this moment, it would be too much to talk about all the different medicines out there, but the idea of, do I need to go on a medicine? The thought would be that if your A1C is 7.5 or 8, sort of on the lower side, not normal, but on the lower side, where you're not symptomatic, you don't know your sugar is high, you found it on a routine test, and you're determined and you're committed, and you say, hey, I'm going to really go out there, I'm going to change my diet, I'm going to exercise regularly, and I want to see what happens, that's very, very reasonable to do, as long as you follow up, and if things don't go as planned, then you're willing to go on therapy. It is a lot harder to lose weight and do all those things on your own. It sometimes doesn't work as well, but if you're able to do it, that's wonderful, and that's often something that people are motivated by finding out they have diabetes and saying, hey, you know what? I want to take charge of this. I want to do it, with lifestyle changes. I'm not looking to do it with medication. So that new patient can take this opportunity to make those lifestyle changes. If I flip it around the other way and give you a different perspective on it, a lot of us think in diabetes that most patients would benefit from being on a medicine first that kind of takes the pressure off, maybe a medicine that will help them lose weight, a medicine that will bring the sugar down while they introduce all these lifestyle changes. And then if they're successful with it, consideration of maybe backing off the medication. So it kind of allows the patient to be reassured, my sugar's coming down, things are normalizing. I really have, bought into this. I'm doing things regularly, activity-wise. I've changed how I eat. I've changed how I shop. I've changed how I, eat at home, all those kind of things. And then they know the numbers will improve because of the medicines, and then they can see how things go over time. I also think that it's a good mindset to walk in the store where you have to really think about what the problem is here. The problem is you've got a high sugar, and that's going to cause damage to the blood vessels. And you're learning now about what those problems are going to be, and you have to think about what's going to help you. So even though a lot of us want to be gung-ho and say, I'm going to, nip this on my own, I'm going to go do it, I'm going to take care of it, and many of you will, and many of you will improve your results by doing all these things. Think about that the goals are really multiple. It's controlling the sugar, but it's also controlling the cholesterol. And even with the best of diets and with the best of goals, it's actually quite hard to get the cholesterol to the diabetic goals that way alone. And the same thing for blood pressure. If you set more aggressive goals for yourself, you may need the help of medications. So you want to have this mindset that I'm open to medications. These medications have been proven to work. They've been proven to help diabetics live a longer and healthier life. And I can take these if I need to, as compared to thinking about I'm going to go at it lifestyle alone. But putting the two together, I think, would be the best way to do it. And over time, as we review more topics for educational purposes, we can go over specific medications and the things that may be tailored more towards you.